antioxidant, sometimes we say the ACE synergy. Vitamin A, vitamin C, vitamin E. Okay, that's called the ACE synergy. Vitamin A normally comes in the form of your carotenoids, vitamin C and vitamin E. Now the combination of that three provides antioxidants. Of course, there are other types of antioxidants also, but these are the common ones, So they help the body. Most of the time we get it from good natural food, but today in the food it is lacking, so it is a good idea to at least supplement your diet with good nutritional supplements.
所以我们常常讲，抗氧化剂，尤其是维他命 A、维他命 C、维他命 E， 它们能够形成很好的所谓的协同作用啊。这种协同作用能够让我提供我们身体很好的这个抗氧化剂。当然，除了 AC 以外，我们还有其他各种不同的抗氧化剂。不过基本上来说 ，ACE 是能够在也能够从食物当中获取，可是食物真的非常非常的少，所以我建议大家都要从这个食物辅食品当中去加以补充这个抗氧化剂。
Okay, and when we talk about causes, okay, there are many things that can cause. Earlier we saw even sunlight can do it. Okay, even when you're digesting your food, free radicals can go up. Even when you're breathing, when there are problems in your cell, mitochondria. Okay, your mitochondria is your power station of the cell. Okay, when all this can contribute to inflammation and free radical damage. Okay, when sugar levels in the body is too high, when your uric acid levels are too high, okay, when your cholesterol get oxidized, all these free radicals will go up, inflammation will go up, So it's very difficult, okay, for the body to handle this on its own without proper nutritional support.
好，有几个主要的原因还会导致这个慢性发炎呢？譬如说，像我们细胞里面的粒线的功能障碍。粒线体什么？粒线体是细胞里面的发电厂。除此以外，我们对于糖的吸收过高，所以当我们的血糖水平升高的时候，还有我们的尿酸，体内的尿酸升高，还有像我们体内的这个胆固醇被氧化的情况底下，都会不断的造成我们这个所谓的慢性发炎的情况提升。
So there are many contributors, okay, risk factors that are associated with inflammation and free radicals both. Okay, as we get older, our risk gets higher. Obesity, when somebody is overweight, especially when somebody is obese, lack of sleep or irregular sleep, that means quality of sleep is a problem. Okay, when your consumption of trans fat is high, sugar, when you consume too much of sugar, hormone problems, not enough water in the body, stress, lifestyle without enough exercise, sedentary lifestyle, okay, and malnutrition, never eat proper nutritional food. All this can cause inflammation, chronic inflammation to get higher and can cause free radicals to get higher.
好，那还有几种风险因素会促进所谓的慢性炎症，包括我们自然的这个老化、肥胖啊，你缺乏睡眠啊，或是不规则的睡眠时间啊，然后身体摄入过多的反式脂肪或者人造脂肪，摄入过多的糖分，荷尔蒙不平衡，喝水不够，压力，然后就是久坐，然后没有运动，然后或是营养失衡，都会造成慢性炎症。
So sometimes the question is this, okay? How to know whether you are affected by inflammation, free radicals, circulation problem? Sometimes when you do a normal blood test, it is not able to tell you much because, a lot of the information in a normal blood test is actually checking what is happening at your organ level. Okay? Now, there's a lot of preventive wellness investigation that is done using the blood, and that can tell us a lot of information. So you see a lot of the markers here. All these are the different parameters that we can check from your body. Actually, the body, okay, is giving us information. It's telling us whether is it okay or is it in trouble. But the problem is, many people are not checking against these markers. They're only checking the basic ones until they end up with a disease. Disease cannot happen overnight. For a lifestyle disease to happen to you, it will take anywhere from 5 to 15 years. But we must always see whether are we on the way to a disease or not. Okay, and the body is giving out signals. So we do a lot, whether in my clinic settings or even for a lot of my students, and a lot of patients and all that who are very focused on wellness and prevention. We do periodic monitoring of checking certain markers depending on what is needed to see what is their levels, and a lot of this testing is actually available today, but certain wellness clinics only will do it. Some of y'all who are interested to know more about this, you can privately contact Everest, okay, and find out more details about some of this screening that is available.
OK， 其实我们的血液检查可以检测到很多所谓的慢性疾病的哈。普通人一般所做的那种简单的血液检测，实际上是没有办法给我们这一些讯息的。所以你可以看得到这个 slide 上面的这些像什么HSCRP 啦、同型半胱氨酸 ESR 这些在其实血液提供我们很多讯息，但问题是传统的这些血液报告里面过度简单，没有这些人都没有测试这样子的东西，所以到了最后的时候发展成慢性疾病，而慢性疾病实际上是不可能1天2天你就得到了，基本上可能从5年到15年，经过漫长的时间的慢性发炎的之后，你才得到这些慢性疾病的。所以我带领的很多学生都有跟我做这一些所谓的这种慢性发炎的这种测试，所以任何人如果有兴趣的话呢，可以联系我Everest， 然后我会给你们知道多一点关于这种慢性炎症的测试是怎么样来做的。
Okay, so it's very important. Sometimes we do not know what is happening in the body, especially if our cells and our tissues are getting affected. Because why? Got no symptom. But once our organ starts getting affected, that's when we feel the pain, the discomfort, sometimes of bleeding and all that. So remember, your organs cannot get damaged if your tissue and your cell is working properly. So it's very important to make sure that at a cellular level, everything is working as per normal. Remember the fundamental of prevention: happy cell, healthy body. Very important.
所以我们的这一些发炎实际上是在这个细胞跟组织当中就开始发生的了。但是最大的一个问题就是，当你的细胞跟组织有炎症的时候，你的身体是没有感觉的。当你的身体有感觉的时候，实际上是表示你的器官已经受到一定的影响，然后器官才开始有感觉。所以这种情况底下，我们不能够把问题拖了这么久，我们一定要从这个细胞跟组织的这个阶段就开始发现这个问题。记得我曾经说过吗？快乐的细胞就有快乐的健康。
Okay, and why it is so important? Because you see all these diseases on the slide here: heart disease, cancer, diabetes, high blood pressure, stroke. All these are lifestyle disease. Okay, we are not born with this, but we get this because of mismanaged lifestyle. Okay, now what contributes to these problems? Inflammation, chronic inflammation, free radicals, and poor circulation. That is the main contributors to all this disease. So we have to be proactive. We need to focus on prevention and wellness to make sure that we are not affected by this disease, number one. Number two, if we are already affected by this disease, then we must be very proactive in trying to slow down, stop the problem, and reverse the condition so that we can come back to a healthy state.
所以可以看得到，慢性炎症就是导致许多主要的这些死亡原因，像心脏病、癌症、糖尿、高血压、中风等等等等。而我们刚才已经提到了这些炎症的发生，包括我们的这个氧化的情况，还有我们身体血循环的这个情况，就是造成这些文明病、这些慢性病的起源开始，其实就是所谓的慢性炎症。那我们要怎么样做？我们就是要预防。如果一旦已经得到这些疾病了，就要找回去根源，然后慢慢把这些问题重新的逆转。
Okay, so that is the topic on inflammation, free radicals, and circulation. Okay, now let's take a 2 minutes break. Those who want to go to the toilet, go have a drink of water and all that. Then we'll come back and start looking at the diseases.
OK， 好，那我们现在大家先休息2分钟，过后我们要进一步讨论糖尿病。
Okay, see you all back in 2 minutes.